Dr. Rich Diana, thanks for coming in tonight because you're going to keep us all healthy for the rest of our lives, I'm sure. You're an orthopedic surgeon, long time, who wrote a book called Healthy Joints for Life, and we'll get to that in a second. But just a little bit about your past. You're from Connecticut, you grew up in Hamden, you played football, so you beat yourself up a little bit. You played for the Miami Dolphins, and you even played in a Super Bowl, and you got a ring on. So I love how we can just show that off a second if we can get a shot of that. He's got a Super Bowl ring, and I think that's awesome, and you wear that a lot. But let's talk about why an orthopedic surgeon sits down and writes what I think is a primer for life. Oh, we're showing your ring now. Just give it one. That's awesome. That's great. Super Bowl 17, correct? Was it 17?
A long time ago, Ann.
Long time ago. Okay, so you're a football guy who becomes a doctor. You're an orthopedic surgeon. You sit down and write a book about healthy joints for life. Why did you write a book?
Well, it really was a book that needed to be written, and there are a lot of impetuses in my life, starting with my mom and her rheumatoid arthritis.
And you dedicated this book to your family, to your patients, to your mom.
Yeah.
Perhaps before we get to that, the first part of your book is so touching about your mom, and she dealt with rheumatoid arthritis, and you saw her decline for years.
Yeah. Well, she really suffered, and you know, rheumatoid arthritis is a terrible disease. The book is more about osteoarthritis, which is more the wear and tear variety. But rheumatoid arthritis, it destroys your joints. It's an autoimmune disease, so it's your own body attacking your joints. And with her, you know, all of her joints were affected, and none of the medications worked. She tried everything you could imagine, you know, gold shots and sulfasalazine and methotrexate.
Because back in the day, that's what you did.
That's what you did, and the medications gave her an ulcer, and nothing helped her. And she went from being very vibrant to being someone who really couldn't walk around, and she had all these different surgeries to help her joints, but none of them really helped. And the disease process ate away at her tendons, and her hands were troubled, and it just was a terrible thing to see her decline, because as she became immobile, then she started to get more problems with heart disease and other things. And so, you know, my relationship with my mother was a wonderful one, but it was based a lot around her medical problems. And I would drain her knee for her, and she would thank me. And I would do other things, you know, to help her. But in the long run, it was very frustrating for me because I couldn't do what I wanted to do most, which was cure her.
So you're kind of doing it now. You play football. As we said, you beat yourself up. You played for the Miami Dolphins. You played for Yale. You become an orthopedic surgeon. What are you doing now for folks that maybe harkens back to what you couldn't do for your mom then, although you did the best you could?
Yeah. Well, you know, technology wasn't where it is today, and it's still not where we need it to be. Rheumatoid arthritis is a terrible disease process, and osteoarthritis is equally bad. 50 million people in the United States suffer from arthritis. I mean, that's a vast number. That's 1 in every 6 people.
And we're living a long time.
Yeah, and so the older we get, the more osteoarthritis we get. But things have changed in the last 5 to 10 years, and that's really what the book takes advantage of. We have so much better technology now, and we have a better understanding. And America really doesn't understand yet what we need to communicate to them. And that's what the book is all about, trying to communicate to them that pain relief is available to many, not to everybody, because some people need mainstream medicine. Some people need surgery. Some people need, you know, over-the-counter Advil or Aleve. Some people need prescription pills like Mobic or the other anti-inflammatories.
And that, inflammation, you say, is a large part of this.
Yeah. So we fight inflammation in many different ways, and mainstream doctors do it mostly with anti-inflammatories, with cortisone and so forth. But what I learned over the years with research is that there's a molecule called NF-kappa beta. And you know, we don't have to get stuck on that, but we need to know that it's a regulatory molecule. And this regulates the production of inflammatory molecules. So if we can control NF-kappa beta, we can control inflammation. So when I started to learn about this in other areas, like in skin and for dermatologists, in cardiologists, and in heart disease, when I started to learn that they were applying techniques on NF-kappa beta, I said, I wonder if these techniques can be applied for joints. And so I started to look into the research, and there's, behind this book are over 600 references in scientific journals from across the world. So this is a book based on science. It's not just someone telling you to take this one supplement and you're going to be perfectly fine. This is a lifestyle change. This is a recommendation for you to change your diet a little bit. Not necessarily to make your diet bland or uncomfortable for you, but to learn the things that you should be eating and eat them.
Well, you point out garlic, cocoa, blackberries, chicken, salmon, veggies, cinnamon, and it goes on. I love the cinnamon part because I love that. And in fact, in your book, in fact, in your book, you write about apples and cinnamon, and who doesn't like, who doesn't like that?
You're right.
In just 8 weeks, healthy joints. Really? Can we do something in just 8 weeks?
You're going to notice a difference. You will definitely notice a difference.
And in any age group, depending upon what you're suffering from.
Absolutely. This isn't a cure-all. This isn't a panacea. This is something to help a lot of people. You're bone on bone, and you've got deformities in your joints and so forth. Probably isn't going to help you. But if you're one of those people in the middle, then you're probably going to get substantial help from listening to this. And the reason why it works is because it's scientifically based. This is basically saying that, all right, I'm going to teach you a little bit about joints and about why you're having pain. And when you learn about that, then I'm going to show you how we stop that inflammation from occurring. And we're going to talk a little bit about science, not enough to overwhelm you. We're going to talk a little bit about the science, and then we'll apply techniques, dietary techniques. We'll talk about exercise and why exercise is so important, and we'll talk about supplements. Supplements can be very, very beneficial to people. Calcium is a very, very small portion, very important for bone strength and so forth. But there are other things like, resveratrol or cumin. There's a pomegranate. There's green tea. These are all things that are extraordinarily healthy for cartilage in particular, for your musculoskeletal system, for joints. And they're very effective in part because they attack NF-kappa beta.
Now, what does this do for the guy like you who played football and you're beating the heck out of your body?
Yeah.
And what do you do for the athlete? Do you give him the same book and say you can still do this even though you're really going at it and beating your body up pretty good?
We talked a little bit earlier about, one of my inspirations, my mom. And, the other inspiration that I got in writing this book was when I had gone to a 2008 Dolphin reunion. And I saw so many of my friends, my teammates, and they were really beat up. A lot of them had replacements, back fusions. These guys were vibrant, athletic, big, strong guys. And, 30 years later, they turned into people who'd been affected by joint disease. And what it does, it makes you more immobile. It makes you so that you can't work out as much or think you can't work out as much. It makes it so that you get heart disease, so that you get heavier. And obesity is a big problem, especially with ex-NFL players. Obesity leads to so many different things like heart disease. And many people don't realize that obesity can cause cancers too. So immobility leads to all these different problems. It's more than just not being able to go and do what you want, which is really important, but it can also affect the quality and quantity of your life. It can take years off your life just because your joints are in trouble.
So what's the biggest secret in this book? What do we take away from this? The layperson is reading it and maybe they're 50 years old. What's the gem that you put in this book?
Well, here's an overview. If you want pain relief, you can go and get it. You're going to have to work for it a little bit. You're going to have to eat some different things, perhaps. You may have to change your diet a little bit. You may realize that you have to exercise. You can't not exercise and expect your joints to be okay. And you're going to take supplements. And you've heard a lot of things about supplements, probably. Maybe doubting Thomases all over the place. But there's scientific research behind these particular supplements that we're recommending. Just like in the old days, the Indians had heart problems, and they went to the bark of a tree, and they bit the bark, and they sucked on the bark, and somehow their palpitations went away. Well, we found out later that in that bark was digoxin, which is what people take all the time nowadays. So there's some value to supplements. I know I've heard so many people say, I don't know about taking supplements, doc. I've heard so many things.
Because you can take too many, and you can take the wrong ones.
You can take the wrong ones. You know, let's say you take a multivitamin, and you eat a nice balanced diet, and you don't need 9 out of 10 of those vitamins that are in there. What good is that? You need to get the vitamins or supplements that are appropriate for the problem that you have. If you're reading this book, we know the problem that you have. We know you have osteoarthritis, you have joint pain, and we want to affect inflammation. So how do you stop inflammation? Well, one of the ways is to work on NF-kappa beta and the inflammatory pathways.
There's that word again.
Inflammatory, everything's about inflammation in this book. You know, it's not the cure-all for everything, but as far as osteoarthritis is concerned, it's very, very important.
Now, you wrote about a couple of case studies in here. Give me in a capsule a case study where you took a patient and helped him out, and what happened? And give me kind of their profile.
Well, you know, for instance, we have the weekend warrior. The weekend warrior comes in. Maybe it's me, incognito.
They're 40 or 50, I can still do it.
Yeah, you can still
know?
do it. You're
Right.
still going out, you know, and playing basketball or involved in soccer, and your joints just aren't the same. And so you find that you don't recover very well from playing on the weekend. You find that you're limping, that you're sore at work. And all of a sudden, you come in and you see me and you say to me, Doc, you got to help me. And I take an x-ray and I say, well, you don't have bad arthritis. You got a little bit of arthritis, but it's not bad arthritis. And most patients are like, I can't believe it. You're just telling me I don't need surgery? And I'll say, well, you don't have a cartilage tear. You don't have this. You don't have that. You don't have bad arthritis. But I know you have pain, so I have the thing for you, the thing that's going to help you. And you're not going to take pills all the time that can give you ulcers or have side effects. We're not going to have to do surgeries that can lead to infections and different complications. Instead, we're going to do something more holistic. And that usually gets people a little bit concerned.
Wait a minute, doctor's holistic thing? What's happening here?
Wait a minute.
No surgery?
Yeah, exactly. But the thing is that it works. And, you know, there's a lot of people doubt. But when it gets bad enough, then they're willing to try everything.
Right.
And
So
when
what
they try
happened?
it-
Give me that case study. What happened?
So, for instance, one of my patients is a plumber, and he loves to play sports, but he also loves to watch Monday Night Football and eat all kinds of bad things. And so he gains weight, and he plays sports and kind of comes and plays too much, too often, softball for this particular guy. And so we start to talk, and I say to him, basically, you know, you can't keep living the lifestyle that you're living. If you do, you're going to eventually get to the point where you need surgery or you need, you know, a replacement. And so he'll say to me, now, well, you know, what do you want me to do? I said, well, listen, you're going to start eating these nice things. You know, instead of having a steak, you're going to have a grass-fed steak. Instead of having ground beef, you're maybe going to have buffalo. You're probably not going to be able to tell the difference. But the things that you do are going to change things for you. Instead of having a piece of apple pie, you're going to have some sliced apples with cinnamon on top of them. Mm-hmm. And maybe you want to sprinkle some, not sugar, but a sugar substitute like Truvia on it. So we talk to them and we tell them what they can do, and then we say, all right, you're going to take a bunch of supplements too. And these supplements are intended to attack all the pathways that cause inflammation. And the exercise you do is going to be more regular, and it's going to be less punishing on your joints. And they're like looking at me, and I'm, well, all right, you know, I don't want to take this medicine. I know I don't need surgery, so I'll do it. And so all of a sudden, the plumber's weight starts to go down. All of a sudden, he's exercising on a more regular basis, and his flexibility is improving. His muscle strength is better.
It's a mind-body thing.
Yeah, and he's taking some supplements, and the supplements are helping to block those inflammatory pathways instead of medications. And all of a sudden, he comes back after 2 months or 3 months, and you see him, he's a little bit leaner, he's a little bit happier, he's moving a little bit better.
He's got some swagger.
Yeah, he's got his swag back.
How has writing this book changed your practice as an orthopedic surgeon? Has it?
Well, I'm still a surgeon, and
Right.
I've
At the end of the day.
at the end of the day, I've done over 6,000 surgeries, and this is my 21st year practicing in the area. So things haven't changed that much, with the exception of the fact that the way that I practice is a little bit different. As an orthopedic surgeon, most people don't realize that 19 out of 20 people that you see in the office are non-surgical cases. So you have to see 20 people to get one surgical case. You have to figure out how you're treating those other 19 that don't need surgery. And so for me, unlike most of my colleagues, I treat people a little bit differently. And,
They coming down on you for this?
Well,
going,
no,
Dr.
not-
Diana, what are you doing over here?
The interesting thing is when, if you're unreasonable, and I said, I could make anybody better with this program. I could make people with bone-on-bone arthritis and deformity better.
Just talking crazy.
People aren't going to listen to you. But if you say to someone, I can mix a little bit of this and a little bit of that, and it works beautifully. Sometimes you have to use an anti-inflammatory, and you use the program as well, and in combination it works. Whereas maybe one or the other wouldn't work, but together they do. There's a synergy. So, you keep an open mind and you say, all right, I'm going to try to help people in a way that's a little bit different. And the reason why I'm doing that is not just because of whim, it's because of science. So this is a scientifically based book.
But if you're bone on bone,
Yeah.
it's got to be surgery, doesn't it?
Most all the time. Now, this book can be helpful to some people. Like, for instance, let's say you get someone who's 80 years old and they come into the office and they have bone-on-bone arthritis. But unfortunately, they also have bad heart disease. And so doing a replacement on them doesn't work. So you say to them, okay, we're going to do a few different things. We're going to do some mainstream things, like we're going to put a brace on your knee. We're going to put some inserts in your shoes. We're going to shoot some gel in your knee. But we're also going to have you change your diet a little bit. We're going to put you on some supplements, and we're going to have you do this exercise program on your own, in a gym, maybe with someone helping you. And all of that together is going to make you a lot better. Not as good maybe as if you had the joint replacement, but we're going to do the best we can with the situation.
And in closing, what's the biggest gift you're getting from this book? I mean, you've kind of gone outside the box here now. You got this book out here.
Yeah, well, what I can give people is pain relief, and pain relief leads to mobility. And life is motion. If you can't move, you can't enjoy life. You can't go and visit a museum. You can't go to a ball game. You can't go visit someone or dance at your daughter's wedding. I mean, you need mobility, and that's what this is all about. This is about getting people moving, giving them a good life.
Thanks to your mom.
Yeah.
Thanks, Rich Diana, for coming in.
Well, thank you, Ann.
Appreciate it.